Yeah. I know. Hello, everyone. We are going to start our first of the day with our Facebook Lives. We have them back to back today. And today, starting out, we have Dr. Michelle Jorgensen. She's a biological dentist. And a lot of people don't realize the importance of dental care when it comes to natural care because they just feel they just go to the dentist and they're good. But that's kind of wrong, right, Dr. Michelle?
That's right. People actually are surprised to find out that 60 to 80% of chronic disease is either related to your mouth or caused by something going on in your mouth. So it's huge. It's huge in actually regaining health.
Lots of underlying infections for sure. From basically the reality is from dental procedures a lot of times, right?
Oftentimes, things that were done that we didn't realize were actually not lasting as long as they should and causing infections that we couldn't feel. You can't feel, you don't even know they're going on, but your body knows. And your
that
body
doesn't even include the mercury that was being shoved in people's mouth for years, right?
No, which still is. A patient yesterday told me that she just was offered a mercury filling just a week before at a dental office.
Wow, you never hear that anymore.
Yep. Still happening every single day. So yeah, there's lots going on in the mouth, everything from infections to mercury to actually how are you breathing and can you get enough air when you sleep, and a whole bunch of things that we love to talk about because we find answers for people who've been looking for answers.
That's kind of a new wave right now. You're hearing like radio commercials and things like that with the sleep apnea, the breathing properly and all that kind of stuff. And that's one of the things that you're going to be talking a little bit about. You want to share just a little bit about that?
I do, because we handle it a little differently than some others. There are a lot of sleep apnea devices and things that dentists are offering, but what they're doing is they're just moving the jaw forward temporarily while you sleep, which is not a heck of a lot better than the CPAP that everybody hates, which is just forcing air down you. So we look at what is the root cause of the airway problem and how can we actually correct that permanently rather than just giving you a Band-Aid option. So it'll be, if that's something you're struggling with, come and listen to what I have to say, because we have some answers that not a lot of people do. And I'm really excited because we see lives literally change. And every new patient that I saw this week, I'd say probably 80% of them had some sort of airway problem. So I think this is an epidemic in the world today that we don't understand, and we don't realize what this is doing to bodies. It pushes you into fight or flight mode, which throws off your digestion, which throws off your hormone regulation, which throws off your sleeping, which basically eliminates the time that you regenerate and you heal. Yeah. You get rid of all of that and your body doesn't work very well.
So why do you think it has become such a, I mean, like 10, 15 years ago, you never really heard of this kind of thing, right? I mean, there was sleep apnea, but not at the right. Do you think it's because what do you think the reason behind it is? Because people are heavier now. So I know for myself that if I'm over a certain weight, I snore more. And I think it's because of the weight in here, right?
Yeah.
And things of that nature. What is it, because we're just gotten fatter, or it's because what do you think it is?
You know, I had that exact conversation with a patient this week because she has severe sleep apnea, and I would guess she weighs 110 pounds. So I said, you are obviously not the demographic that everybody used to think of. So there's a few things.
Yeah, that's what you thought. People always think of the heavy person, right?
Yeah, you get heavy, start to snore, and now you have sleep apnea, but that's not the case. In fact, half the patients I saw this week were young. So this is a developmental problem. We've changed the way we're feeding infants. We've changed the way that mouths are forming because of sippy cups and pacifier usage and a lot less breastfeeding. And so what's happening is mouths that don't have enough room for tongues and for the tissue in the back of the throat. And that doesn't go away just because the mouth's smaller. Then we go to an orthodontist and they take out 4 teeth because the teeth are crooked. Well, now we've made the box even smaller that all of that stuff has to fit inside of. So it has to go back into where the air should go instead of being able to fit inside of the mouth. So developmentally, and then also nutrition is just very poor. And the number one bone that's affected by malnutrition is the top jaw. That's the first bone affected. And I'm not talking people who are starving. I'm talking food that doesn't have nutrients in it. And we eat a lot, but we're malnourished because the food doesn't have nutrients and we're coming out with small jaws. Why do you think everyone doesn't have room for wisdom teeth anymore? Because our jaws haven't formed adequately like they used to. There used to be plenty of room for that. We don't have it anymore. So now all of a sudden we have very small boxes that all of this has to fit inside of, and it doesn't. So it goes back into the airway and we don't breathe anymore. Huge epidemic.
That's interesting because it's like everything that we thought would help with our child, with bottle feeding and pacifier and all this kind of stuff is actually hindering us, and we don't really realize that.
How does like a pacifier affect it? Just because the constant sucking, it's bringing things tighter, or why?
And it's a different shape. It's a different shape. So the tongue has to go to a different place when using a pacifier than it would when sucking on a breast, and so it just changes the shape of the mouth, and it forms a lot narrower and a lot taller because that pacifier goes up into the roof of the mouth instead of something else. And
Okay.
it changes the shape completely. And now, thankfully, we can undo that shape change. So, the last thing I do is want to guilt mothers. We're all doing our very best. I'm a mother too. I know the last thing I wanted is more guilt. So that's not what I'm about at all. I'm actually going to give answers. So we say, all right, your child's mouth's too small. You can tell because the teeth are crooked. Well, guess what? We have some intervention appliances we can use while they're growing to actually even prevent them having to need braces later on, and to help them with sleeping, and to stop bedwetting, and to help with ADHD symptoms. And so we're all about prevention and treatment, not guilt. So there's things we all did know.
It is crazy how many different things affect our system. Like you just talked about, like possibly it can be a correlation with ADD. Well, so is food coloring. So is this. So, I mean, there's just so many things. And that's one of the cool things about the conference is we had so many different speakers talking on different things. It can be several different things. Yeah. It can be lots of different things that can be affecting our health. And it's just about trying to figure out how we can now figure out what it is for us that we need to do. So like all of our kids, it was really frustrating. Like they were all breastfed. They were all breastfed for a while. I mean, most of them were 15 to 18 months, right? It was frustrating when none of them would take a pacifier, because it was like, holy crap, can we please get some help here? But now it's like, oh, yay. Okay. We had a little win.
Happy. Yep. Yeah. Such good information. I love what you guys are doing. And I love that you're bringing everybody together, because it gives the whole picture. And that's what I think we're often missing, is the whole picture and everything that's potentially happening so that you can finally get answers. So thank you for what you are all doing.
Well, we are trying our best. That's for sure. Right now, we got just over a week left before the conference. So it's all about getting people there. We know we're going to have an incredible event. We got great speakers. We got 100 vendors, and seriously, a lot of these vendors, I didn't even know they existed. So that's how cool this is, right? And
I'm excited.
All on natural health. And there's so many answers that can be given to people. That's why we want to get people there so that they can experience this truly life-changing event.
Awesome. Well, and also like Michelle, I am just astonished by like just the knowledge that you've had, just our few conversations that we've had here and there, like with the podcast and just talking. You are so well knowledgeable, and I love the approach that you take where you just get back to the basics, because when people go see you, it's not like going and seeing a regular dentist. No. It's like, let's look at your whole overall health. And also, if people go onto your website and see the different things that you do, I mean, you have books that you have written. You share your garden wisdom, how you grow your own. You have a greenhouse, right? And you grow a lot of your stuff.
Yep. Yeah, I have a class tonight teaching all about spring gardening, actually.
I know. I think it's amazing that, you're just not a doctor, a dentist that you just go see, but you really educate people on the wholeness of your whole health. And that is what this is all about, is about teaching people how to learn about their whole health. And I would love to go see a dentist that was concerned about more than just my teeth, but what's going on in my body.
Well, that's kind of the foundation of biological dentistry. Can you just explain really quickly, because we're on a time constraint, what the difference between biological dentistry is and just regular dentistry?
So regular dentistry means you go in, you have an exam, they look at your teeth and they say, oh, you have a cavity. And they schedule you back in 2 weeks to get the cavity filled, and you go, you get the cavity filled, and then you come back in 6 months and it starts all over again. But nobody says, why do you have the cavity? What should we do about that? Is it just because you didn't brush your teeth? Well, probably not. There might be something else to it. And what is the filling material that we're going to use? Is that actually going to affect you in a negative way? And let's look at the stuff you had before. Is there something here that could actually be causing some of the autoimmune disease you're coming in with, or whatever else it might be? So we just take a step way back from the teeth and say, The teeth are connected to the rest of you. Now, what can we do for all of you in looking at the teeth and helping with your teeth? So that's really what biologic dentistry is all about, is just really acknowledging the fact that the teeth are part of us and it probably has an effect.
And there's not there. I think I may be wrong, but there's what, 8 to 10 in Utah? They're certified. Is there a certification that you do?
There's no certification. There's no actual official specialty. So it's more of just
it's just the approach.
Focus, an approach of care.
Yeah, I always explain it that if you're going to go in and get your fillings taken out, and they're just doing it in the open, that's not what you want. You want to go to a dentist such as yourself that call themselves a biological dentist, because they're like in hazmat suits, man. They got things come, they got everything taken out, those vapors, so it's not going into you, going to cause a problem.
Exactly.
Well, and you also struggled with that, and so you realized how it damaged your body, and needing to take those proper procedures. So now Michelle, she's going to be, Dr. Michelle Jorgensen. She is going to be one of our speakers on Saturday. And for her and all of her followers, there's a code. And you can see it at the bottom of the screen, though. But do you want to tell them what it is?
Tooth 30. Which actually is funny if you think about it.
Yeah, so if you use that code, then you get in for only $30
for the 2-day live event.
Yeah, awesome. And she is so well knowledgeable. You are going to want to make sure you see her class, because you will leave from her class knowing way more than when you walked in.
And that's what we're trying to do. That's what the whole conference is based on, right? Yeah. So I hope you share our conference today with your people that you're having your spring class, because we want them to come as well. I mean, and it's all about getting the word out. So please like and share this video. It's going to be on Facebook. So if you're watching this, please share it on your own Facebook page, because there's so many things that can be helped, and there's so many things that people want to learn, and that's what we're trying to offer at the Be Healthy Utah Conference.
All right, Michelle. Well, thank you for joining us today, and everyone, go get your ticket, and so you can come and see her and be able to experience all of her wisdom she has to offer. So,
and we'll see you next Friday and Saturday.
Okay. All right.
Bye-bye.
See you later.